This video starts on a white screen. The Microsoft logo appears. The screen fades to black. A green background featuring the letters A and I appears, followed by a slideshow showcasing new technologies.
AI for Accessibility is a Microsoft program committed to influencing the future of technology to empower people living with disabilities. Whether reimagining the future of accessible education, building experiences that are accessible for people of all abilities, or developing AI-powered technology to make the world more inclusive, we are pushing the limits of what AI can do.
Screen fades to black, a speaker appears.
Thank you so much for joining us today to speak about mental health. It's a topic that has gained increased attention and awareness. There's a lot to learn through the lens of intersectionality, such as disability, unrepresented minorities. I bet that you have been doing a lot of research and work on this. Do you want to kick us off on the topic?
Yes, I am here to talk about disability intersectionality a little bit here before we jump into this good discussion. And, disability intersectionality is basically looking at the relationship between disability and other identities. And today we have the opportunity to talk about mental health, and specifically mental health in Black and African American communities. Our team has done a lot of work in this space as we look at societal biases and healthcare access and opportunities for mental health in Black and African American communities. And I'm so excited to be able to engage with Dr. Hairston and Dr. Washington here today.
The team at Howard has been doing amazing work with the Visibility Project. Can you tell us more about the project and the work that you're taking on?
The 1970s and before, we know that African Americans and Black Americans, specifically Black males, have been overdiagnosed with schizophrenia. There are these disparities across the board, but the one that has been studied the most is within schizophrenia and the Black patient population. A lot of times people think that healthcare is about the access, but truthfully, healthcare disparities is not just about access or what's in someone's medicine cabinet. It's about the structures that are at place. And a lot of times there are systemic biases that are affecting the care, the diagnosing, and the treatment that our patients receive. So the purpose of the Visibility Project is to bring light to this and to highlight these biases and really discover and discuss and bring attention to how we can change this.
For the Visibility Project, the team is using virtual reality and virtual reality scenarios in order to drive empathy in that patient and doctor relationship. Can you tell us more about the scenarios at play and how you envision that to work?
So the scenarios that we have designed, the clinical scenarios that students, trainees, hopefully anyone who undergoes this experience goes through, is really seeing things from the other side. A lot of times when we are physicians, psychiatrists, clinicians, we don't know what it's like for the patient. So the idea is really to bring visibility to the patient side, to show what they experience, to show how biases and also how social determinants of health impact their visits, to give you a greater idea about not just the patient that you see in that few 15 or 20 minutes, but what's going on with them as a whole. It's a holistic approach using virtual reality.
And following up on that as well, what we also do is try and give the person immersed in this environment empathetic scenarios that will show them and hopefully expose them to some of the things that their patients are going through. And specifically, we look at human body-based information, which will allow us to understand the stress and the anxiety that a patient may be undergoing who has been misdiagnosed with schizophrenia.
And so this sounds like we're talking a lot about cultural humility, and that's something I do talk about in the space of disability intersectionality. So I love to hear it in the work that you're doing there. We're also having a lot of discussions around patient and provider advocacy, and I can see how what you're putting together here can actually translate to provider-led advocacy, because they now have that sensitivity to their own biases and they're better able to deliver quality care because they're, as Dr. Hairston said, and as you've said, Dr. Washington as well, they're providing holistic care and they're taking their time to be thoughtful about their assessments. Is there anything else that we could chat about here in terms of building cultural humility and the types of outcomes that we anticipate after the training of your students and others that get to benefit from this experience?
So I'm happy that we're addressing cultural humility and not cultural competency. I think it's important that we really understand a shift, that you cannot be competent in someone else's culture. We're not a monolith, and you can't possibly understand every aspect that someone is going through. So cultural humility really encourages the appreciation of others' experiences, but also your understanding of what you've gone through, your cultural background, why you believe certain things, and what has led to that, and what has led to some biases that people experience. I think the idea is for physicians to come out, including the students, to come out from this and ask yourself, is this how I would want to be treated? Is this how I would want my insert any family member, friend here? Is this how I would like my brother, sister, grandfather to be treated when they're seen by a psychiatrist, when they're going through an issue that needs help? Is this how I want them to be treated? And really to encourage and promote empathy here so that you understand that we are all people, and a Black person's experience is different in this country, in this education system, in this housing system, in this healthcare system. And generationally, they have gone through many things, not just what you see here contemporarily. So are you appreciating all these things? Are you thinking about all the things at play when you see this person in your emergency room or in your office for just 20 or 30 minutes? So we're really hoping that it promotes understanding, empathy, and just giving people a chance for access to treatment that's equitable, despite what you might have learned, despite the biases that are in place because of society, because of what you learned, and because of medical education, to be frank.
It's incredibly exciting to think of the opportunity ahead, right? There's clearly an opportunity to change things. And I have to ask, what is your wish list for what the future holds in this space?
For me, I want this to be something that is used throughout this country in medical education. I think that a lot of times curriculum do not address biases in healthcare, be it mental health, be it OBGYN, be it surgery with increased amputations. We see these disparities in care across the board, across all specialties, and it's something that needs to be addressed at every level. So I hope that this is something that can be used in medical school, in medical education, in residency training. And then also, a lot of times the students and the residents, they're activists, they're advocates, they're ready. It's the more senior and higher ups who also would need to use this training as well and undergo this experience so that they understand what some of their students are trying to tell them.
We're talking of intersectionality and disability and unrepresented minorities. And I have to admit, this is a topic that I've only recently started learning about and wanting to learn more about it and educating myself. If you were to give us all homework in terms of learning more about it and doing something to become allies of this space or active members of the community, what would be your advice?
We're talking about mental health. I tend to apply the social determinants of health framework to get people to think a little bit deeper about the disability experience. And the value in that is that you start to look at all of the factors that contribute to a person's lived experience. And then it helps you not try to look at the community overall and say, this is the disability experience. And it challenges you to look at each individual and understand where they're coming from, and then add that experience to your collective understanding of the disability experience, of what it requires to make accessible designs and accessible experiences for people who are in health systems or leveraging technology. So what I would challenge people to do is take some time to do a little bit of reading, a little bit of reading about disability intersectionality itself. We now have an at-a-glance video, which is only 2 minutes long, and it kind of talks about what that disability intersectionality is from our perspective. But there are other resources out there that will introduce you to the concepts. I do encourage people to understand what intersectionality is independent of disability so that they're able to understand them as a pair. And then just make sure that anything that you do when you're trying to inform yourself and educate yourself, that you seek information from different sources that you wouldn't normally seek, so that you don't just have a biased understanding of what any population is going through.
So a good book to read is Harriet Washington's Medical Apartheid. And then another good book to read is Jonathan Metzl's The Protest Psychosis, How Schizophrenia Became a Black Man's Disease. So those are good starting points.
I know I'm taking homework for sure on board, so thank you for the recommendations in terms of the reading list, as well as what we can do more. Any final thoughts for our community?
So microaggressions and racist language are riddled throughout our speech every day. I constantly do it. And so for myself, I think I don't realize how it makes others feel. So specifically for this as a party message, I would just say, as we are building technologies in these immersive environments, it really starts with us, and putting the technology in front of a person doesn't mean that they're going to watch it. However, we hope in this situation that the medical professionals will watch it, they'll become more empathetic, and we'll get much better with the way that we speak to each other and how we're impacting each other on a daily basis.
The take home that I want people to go home with is that healthcare, mental health care specifically, is not just the appointment that you're in. It is social justice, it's food security, it's housing security, it's biases that are at play. It's structures, it's cultural norms, it's what's accepted, and it's what's advocated against. I think that we need to make sure that we understand language is important. Even facial expressions are important. How you react when a patient tells you something, it's important. Their access to care, digital access in this time of the pandemic, when whether or not you have the choice or the ability to use your mobile phone or your computer to see your physician. And if you're locked out of care, if you can't do that, there are so many systems at play that we can't just address healthcare from one level. It's a system, and we have to address it on a systemic level so that we can help the individuals who are a part of it.